Hi there. How many times have you found yourself waking up, or somebody that you love waking up in the middle of the night with this feeling of heartburn or this thick feeling in the back of your throat that's burning or uncomfortable, making you feel like you can't sleep, or maybe sometimes even feeling like in this acidy feeling in your stomach? That's GERD. I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible, 7 Keys to Defy the Odds. And today I'm going to talk to you about GERD and an possible integrative medicine approach to GERD. So a lot of people get GERD and wonder what might be causing it. And often you're given medications like stomach acid blockers or omeprazole or various kinds of medications that might help with the symptoms temporarily. But in the way that I practice medicine using both Chinese medicine and functional medicine, I blend the two in order to find the root cause. And there are many root causes. And what might surprise you is that stomach acid is not usually elevated when you have these symptoms. In fact, it's kind of the opposite. So, as people get older, often their stomach acid levels decline, and then that causes the food not to digest as well. And there's this weird, like, paradoxical thing where because there's not enough stomach acid, the little bit of stomach acid that there is kind of floats to the top, and that's what comes up into the esophagus and can cause the symptoms that feel like heartburn or a burning in your throat or a feeling of acid coming up in the back of your throat. And sometimes it'll cause a cough in some people, or it'll cause even asthma symptoms, like where you can't breathe in the middle of the night because you have acid that's coming up and getting into your lungs. So, but it's often not because of too much stomach acid. It's actually often because of not enough stomach acid. So there's all kinds of things to do in order to figure out A, what might be causing it, and B, how to solve the problem. So I'll start with what might be causing it. So, one of the elements that can affect stomach acid or the symptoms of a GERD is H. pylori. H. pylori is a bacteria, Helicobacter pylori, that is known to cause ulcers and is also connected actually with possible risk of stomach cancer and can be connected with the GERD symptoms. So, what's interesting is that H. pylori actually lowers your natural stomach acid, which then can contribute to those symptoms that are affecting it. So, first of all, you want to do a test to figure out if you have H. pylori, and that can be done either with a breath test, a blood test, which is not as effective in diagnosing it, or a stool test, which can show whether it's there. And there are different kinds of stool tests that actually, one kind of stool test that'll look for the actual bacteria, and another kind of stool test where you're looking for the DNA of the bacteria, which can be a little more sensitive, where it'll show up in even small quantities if you're looking at the DNA of the stool or of the bacteria. So that's one thing. And then another is to do a trial of supporting your stomach acid. So let's say you turn out not to have H. pylori, but you still have the symptoms. So you could do a trial of supporting the stomach acid by taking either hydrochloric acid, or some people take apple cider vinegar in small amounts before a meal. Like you could do a half a teaspoon even to start, and it'll help support the stomach acid. Another thing that can be very helpful is actually just chewing your food really, really well, because the digestive process starts in your mouth. And if you spend enough time chewing your food, then by the time it gets to the stomach, it's already broken down. And then the whatever little amount of stomach acid there is can help digest it, and then it can go through properly. Now, a lot of people also who have low stomach acid or GERD may also have SIBO. SIBO is small intestinal bacterial overgrowth. And SIBO is the cause of many mysterious gut issues. And one of the causes of SIBO is actually low stomach acid. And there is also that possibility that SIBO itself can cause low stomach acid or can cause GERD symptoms. So it's a back and forth sort of connection. And then another possible cause is foods that you're eating. So one of the things that commonly people do is they eat their dinner and then they go to bed shortly thereafter. And it's best if you have symptoms of GERD to wait at least 2 hours after eating before you go to bed so that you have time to have the food start to digest and get out of your stomach. And so then it won't be coming back up. Another thing that you can do is not eat a lot of carbs. So, white foods, processed foods, carby foods, especially in the evening before bed, can cause that symptom to get worse. So, you could cut out those foods. You can also look for food allergies. Some people who have GERD, and maybe they develop it later in life again, but it might be connected to gluten sensitivity or dairy sensitivity or some other kinds of food sensitivities that could be connected to uh, causing it causing you to have problems digesting your food. So, and then from the Chinese medicine perspective, there are also many possibilities of what could be causing it. So, in Chinese medicine, your ability to digest your food comes from your spleen. So, it would be kind of like in the Western medicine, it would be the pancreas. But your ability to take in food, transform that food into energy, transport it to the rest of your body, and so that's breaking it down. And then the spleen is paired with the stomach, and the stomach's job is to actually cook the food. So that's what the stomach acid does, is it cooks the food. So you could have something called stomach fire where you actually do have too much acid. This is more common again in younger people where there's a stomach fire and food is coming back up because there's too much acid or an infection that could be causing it. So H. pylori could also contribute to a stomach fire sort of situation. There's also a stomach deficiency or a spleen deficiency. And when you have that, that would be more connected to having like a low stomach acid. I'll talk about acupuncture points for that at maybe my next one, where I can give you some acupressure points that could help support your digestive fire and your digestive chi so that your body can do what it needs to do in order to digest food. The spleen and stomach do a whole bunch more of other things as well. They regulate your ability to concentrate, the strength of your muscles. And similar to Western medicine, the spleen makes the blood and it holds the blood in the vessels. So other symptoms of digestive weakness, like spleen weakness, would be weak muscles, not able to build muscle, um, easy bruising. That's a very common symptom. People who have hemorrhoids, often it's because their spleen chi is weak, so their digestive chi is weak. And I think that actually in Western medicine, it's very common to have a weak digestion because we eat cold, fatty, fried foods and processed foods. And those foods are all really hard on the digestive system. So the things that are easy for the digestive system are lots of vegetables, mostly cooked, and chewing your food really well to make sure that it breaks down in the mouth before it breaks down in the stomach. And then also just making sure that your stomach has enough chi, energy, in order to support your digestive processes. In terms of treatments, uh, many things can be done naturally in order to support your GERD symptoms. One is, like I said, you can try using hydrochloric acid as a supplement to help break down food in your stomach. So, like when you're eating the food, if you don't have H. pylori, or even if, because if you have H. pylori, actually adding stomach acid doesn't particularly help right now. But if you want to experiment, you can try taking some hydrochloric acid, and it will help digest the foods so that you can then see if that helps relieve the GERD. You can also try a half a teaspoon or a teaspoon of apple cider vinegar, put it in a little teeny bit of water and drink it before you eat, and then see if that helps reduce the amount of GERD symptoms. There's also something called DGL, which is deglycerized licorice. Licorice, when it's not deglycerized, the glycyrrhiza in licorice can affect your adrenal glands, which can cause adrenal problems. So you have to have it deglycerized so that it will help soothe your stomach without actually causing more problems in your stomach, in your adrenals. So you don't want to raise your blood pressure or something like that. You want to do DGL. Also, aloe can help calm the GERD type symptoms. And what's interesting is there was a recent study on melatonin and melatonin with B vitamins and tryptophan, which is helping sleep. It was shown that it actually had a very high percentage in the study that was done. It was double blind controlled, had a like a over almost 100% relief. It was a small study, so it's not entirely credited, but it had almost 100% relief by taking melatonin that was like in a sleep formula that had tryptophan and B vitamins in it, and it helped relieve the GERD symptoms. Maybe because it helps give you deeper sleep, but it also seems to help relax the sphincter at the base of your esophagus. So I thought that was really interesting. There's another reason that people get GERD, and that is that they have something called a hiatal hernia. And what that is so the diaphragm is the sort of the barrier between your heart and lungs and the stomach, and a piece of the stomach can come up through the diaphragm into the next to the esophagus, and that is called a hiatal hernia, where the top of the stomach goes up into the chest cavity. And so there's different manipulation techniques and acupuncture techniques that can pull it down and help support it. But so that is another thing that can be done if you have a hiatal hernia. So as you can tell, that there are many natural possible treatments that can help relieve some of the symptoms of GERD. And if you have any questions, please feel free to leave me a note here in the comments. I'm always happy to answer questions. I hope you have a wonderful day, and thank you so much, and we'll talk again soon.